Are live. Well, not yet on Facebook. Oh, yes, we are.
Yes, we are. Yes, we're live, John.
Yeah. So welcome. It's a Happy New Year, right? It's our first show of the new year, and we just want to welcome everybody back. As you know, we've announced that we're going to be changing the shows, right? We're going to have less shows throughout the month. So just stay tuned to our posts to know what the topics are and who our guest speakers are. But today we have a reoccurring guest, a special guest, Dr. Theresa, who's going to be joining us today. And she's going to be talking about something that you probably have heard of. I've heard of it, but I thought it was like a Japanese dish. I thought it was something else, but she's going to cover that. And so I am John. Hi.
Hi, I'm Cyrene.
And let's bring Dr. Theresa on. And when she comes on, I'm just going to share her bio, but I'll bring her on first. Okay. So while Dr. Theresa is joining us, so Dr. Theresa, just share a little bit about her. Dr. Theresa is definitely not a stranger to our show. She's a certified functional medicine chiropractic physician whose purpose is to solve for patients' health issues through balancing their biochemistry with natural compounds such as herbs, vitamins, minerals, transmitters, or neurotransmitters, bioidentical hormones, chelators, binders, phytonutrients, and more. She focuses on advanced testing procedures and an extensive health history to create an effective treatment plan for her patients. She was an actual research scientist before this at a pharmaceutical company and has dealt with her own past significant health issues that only improved through natural means. And she's raising two beautiful women and is the owner of Health Up. She's the director of Health Up Institute since 2011. And she's an active lecturer, educator, as we know, on many health topics, and an international speaker on iodine therapy and its a crucial role in our health and healing. So besides her chiropractic doctorate degree, she has a Bachelor of Science in Chemistry and Master's of Science in Environmental and Industrial Health from the University of Michigan. And she's a lifelong learner with an open mind of combining the science with energy medicine, as she's also been trained as a Reiki master teacher and yoga instructor. So welcome again, Dr. Theresa.
And Happy New Year, Dr. Theresa.
Yeah, Happy New Year to you guys too, and everybody out there.
Hi, Fatima. She's joining. She's on. So she's not feeling well, and we hope she feels good soon. So today's topic is Hashimoto's, right? Big word.
Yes.
Heard of it before until I talked to you. I had no idea what that was. Can you share kind of what it actually is? And
Yes, John, definitely. Hashimoto's thyroiditis. It is more prevalent than we want to realize, and a lot of people have this missed, and especially women. But Hashimoto's thyroiditis is an autoimmune disease of the thyroid. It is where your body begins to attack the thyroid tissue, causing damage and decreasing the amount of thyroid hormone that you make. It is something that often does not get diagnosed until much later stages, and therefore a lot more damage is done. So bringing light and information to this is so important, because overall hypothyroidism, most of the cases, up to 97% of the cases of hypothyroidism is Hashimoto's, is the root cause. And there's many things we can do to prevent it, to catch it early, to have various treatment plans, some medical, some non-medical, lifestyle changes, nutritional deficiencies. And that's what I would like to, thoroughly discuss during this topic. And I know there's some questions that we want to go through. But the importance of the thyroid hormone, it regulates our metabolism. It regulates the energy of all the cells in our body. So your mental capacity is regulated, very much by your thyroid, your detoxification systems, your liver, your heart, any energy that is necessary, needs the thyroid hormone. And that's why all the cells of your body utilize thyroid hormone. So if this master gland is not functioning optimally, it's decreasing its strength, its ability to run the rest of the body, you're going to have a myriad of symptoms. And that's part of the problem of pinpointing what's going on. And lab work is a very important aspect of this, but that is not always going to give us a diagnosis until very late stage.
So what age does it start at?
The most common ages is 30 to 60, but definitely women and men in their 20s and younger can actually have it as well. And older. Older is usually because they've had it for a long time and they're finally diagnosed with it. But women are much more likely. Up to 5 to 8 women per every one man will get diagnosed with hypothyroidism and Hashimoto's.
So it sounds like the thyroid's, just underneath our collarbone, right down here.
It's above your collarbone, right at the base of your neck. So it's a butterfly gland. It's right here.
Okay.
And your neck should be nice and smooth, no bump or puffiness. If you look in the mirror and you can see a bump or puffiness and you can't get your bones or anything to come through, you want to start considering, hey, there's something going on in my thyroid, even if your laboratory numbers are okay. And one of the, key micronutrients that we need is iodine. And that's something I definitely want to talk about, different micronutrient deficiencies and how they affect the function and the health of our thyroid. But iodine is necessary for making thyroid hormone. And iodine is what was used, it started in the 1920s with some big studies of why people had goiter, and the iodine got rid of the goiter. The thyroid, when your iodine levels are low in your body, our body is super smart. So it's going to want to increase its surface area to filter more blood and to pick up any last ounce of what it needs out of it to, make thyroid hormone for you. So the thyroid gland will actually swell up to create more surface area. So it gets more filtration to pick up any iodine that it can. So you have this iodine deficiency creating this goiter.
So when you mentioned for people that get diagnosed, in their 30s to 60s, but this has been building for many years, maybe decades. So that means it sounds like that you should get tested early. So if you're 30, 40, does that mean you should be tested when you're in your teens or even earlier? Like how, especially is it genetics? Like, does that have to play with it? Because if you do, then you should be monitoring since you're a child and then moving forward.
You're absolutely right. Baseline testing in general for many things is a good thing to do. So, because there's large reference ranges in all lab work. And so you want to know kind of where you fall and maybe how you might, shift a little bit. And hopefully when you don't have any symptoms is the best time to get a baseline, because that perhaps is your optimal health without symptoms. And the symptoms of hypothyroidism and Hashimoto's overlap with a lot of other issues. And people don't understand that a key solution to what those symptoms are is most likely their thyroid. So even though there are many other reasons that can cause the symptoms I'm going to describe, the thyroid needs to be functioning optimally. So young people, especially like teenagers and in their early 20s, will often exhibit more psychological disorders like anxiety, depression, panic attacks, OCD. There's a huge portion of psychological disorders that are linked to actually low thyroid function. And it's actually, if you look at the blood work, it's considered suboptimal thyroid function because the parameters or those reference ranges are there for this huge disease state. They're not for a functional optimal state. So you have to have a keen eye, a functional medicine doctor looking at what is going on. So that is one of the first signs and symptoms. But having fatigue, inability to lose weight, or gaining, some people will lose weight rapidly, which is interesting. So I'm going to talk about that in a second. You can have spurts of high energy. You could feel like you want to sleep all day. You start losing your hair. The last third of your eyebrows start going away. Your skin and your nails, become dry and brittle, or they can become all sweaty, and you may or may not get a goiter. So what happens is when your thyroid is starting to have some trouble, it's essentially, it's sputtering. Think of a car that's sputtering. maybe it's running out of gas. So what does it do? It goes, because this big jerk of gasoline to make it go along, but then there's nothing there. So then it just, wants to slow down, but it might try again because you're stepping on the gas pedal and you're trying to, whatever juice is in there, gasoline, you're trying to squirt it through. So when the thyroid is first being affected, people often have hyperthyroid symptoms. Like they might go through that manic phase. And they get, bipolar disorders also linked to thyroid issues. They can go through a manic phase or they go through a high energy phase, but then they crash and they feel real tired and fatigued. Sometimes that can go on for years. And that's what makes it really challenging to diagnose because you're like, well, this has been going on for years, but at some point it will, boom, it will just become more of where you're having fatigue, you're having lethargy, decreased focus, decreased memory, issues, having motivation. They're all linked to low thyroid hormone in the body and this dysfunction.
Dr. Theresa, I have a quick question for you. Like some of the symptoms that you're describing actually is similar to being in perimenopause and menopause. So why is that a crossover? Is that why don't we question these things earlier?
Why we don't question it earlier, that is a question for the universe. I don't know why doctors don't question this earlier, but you're actually hitting on a couple of very important issues. One, the fact that I mentioned earlier, women are much more likely than men. And it has a lot to do with our hormones and the fluctuation of our hormones. And women's bodies go through a lot more stress than men do. Every month we're having an increase of estrogen and progesterone, and then luteinizing hormone and signaling and follicular stimulation. It's a lot going on a monthly basis. This isn't like a once a year thing we go through. This is every month in a woman's body. So all her glands, outside the ovaries, they're all adapting. The thyroid has to adapt. The adrenals have to adapt. The breast tissue adapts. The liver even adapts. The liver makes hormones as well. And it converts your thyroid hormone. So all these things have to adapt. So when a woman goes through a major hormone shift outside of normal menstruation, which would be during pregnancy and perimenopause, some major symptoms can occur. So a lot of women, just on a side note, because it can be a huge topic on its own, the infertility, they often have thyroid issues. They may have low thyroid hormone going in, which is dysregulating their whole system because there's also a link to low progesterone. So it all correlates. But let's say, they get pregnant, they make it through their pregnancy, and after they give birth, because iodine is critical for, of course, your thyroid and making thyroid hormone, but for the growth of the fetus, the growth and development of the baby and the baby's brain and entire cells. So it'll take all that from the mother. So if she was already deficient, it gets worse. And then that huge shift in after you deliver and your hormones just boom, it is a major change. That change significantly stresses the thyroid. And a lot of women get diagnosed with true hypothyroidism. So it was already kind of going on beforehand, but now their reference ranges are out of whack, high TSH, low T4, or if the doctor does check for antibodies, which is often not looked for, could be sky high at this point. And it was because of that hormone shift. Now, pregnancy, of course, is very rapid afterwards, but perimenopause, which for some women can be a year or two, or it can be up to 10 years of this crazy dysfunction of the pituitary signaling to the ovaries and slowly shutting down. Now, why is it 10 years for some women? I think that also relates to perhaps other toxicities in their body. What's going on? There's other things going on. It is all related. But beside that, the hormone issue in and of itself, up and down. A woman has a cycle, then she doesn't have it for 4 months, then she has it every 2 weeks, like 4 times. I have these patients, and then they go another 7 months, and they're waiting for the 12 months, because if you don't have your cycle for 12 months, you're officially in menopause. But no, they get it again. And all this is just their thyroid is just having to respond to these major hormone shifts. And medically, they'll say, oh, you're just going through perimenopause. That's where your fatigue is from. That's why you can't. Well, it is true. That is where the fatigue is from. That's why you can't focus. Your hormones are shifting all over the place. But what is that doing to your thyroid? And how is your thyroid keeping up? Are you looking at what is happening at the tissue of the thyroid? are you now creating antibodies because there's so much stress going on in the body? And the antibodies come from many reasons, and we can talk about that, but that could be going on. And when you go through this alteration, when there's stress on the body, the way thyroid hormone is used, it gets regulated by many biochemical responses going on. And it has to convert to T3 being the active form. That is what is going to actually run your systems is T3. Your thyroid does make a little bit of T3, but it mainly makes T4. Well, the rest of your body, your adrenals, your liver, your brain, all these responses going on, and your liver does most of the conversion. It can convert in the muscle and some tissues, but your liver will go, hold on, this person's under a ton of stress. We don't want to give her a lot of energy. We need her to calm down, go to sleep, rest, and let's heal, young lady. So it converts to, instead of free T3, our active form, it converts to something called reverse T3, which reverse T3 is like a brake pedal. It looks just like free T3, but it's a mirror image, and it goes around and attaches to the exact same receptor site as free T3, which would give you energy. But reverse T3 goes to calm you down. It slows you down. It will physically make you feel more tired and fatigued, but it's because the body's telling you, hey, stop working 60 hours a week and being busy and having a life and raising your kids and doing, just go sleep and rest and let your body heal. But we don't do that. So it's this constant battle, but it's a key aspect the body does. So you need to look at reverse T3 as a marker of what other stressors are going on. When I evaluate patients, we look at many things, their adrenal function, what's going on, an all-day adrenal test, how their cortisol and DHEA is responding. We look at toxicities and heavy metals in their body. Number one, we look at iodine levels. We'll look at blood, but we do a 24-hour spot and load to see their whole body saturation. Because if you don't fix the basic biochemistry of how cells work, just go back in science to basic physiology and fix these little nuances, the rest of the body cannot heal by going, oh, you have high TSH, which is thyroid stimulating hormone, meaning that your thyroid's not making enough thyroid hormone. So it's a true fact. You need thyroid hormone. So medically, they'll say, here you go. Here's some, levothyroxine, which is T4, and expect that all these underlying issues going on, these imbalances of conversion, of adrenal stress, of toxicities, all these things that could be going on, we'll just give you more thyroid hormone. And your liver's just going to laugh and go, well, I'll just make some more reverse T3 and make her sleep more. It's just kind of frustrating because sometimes we do need some prescriptions, because you can also get T3, and it's called Cytomel here in the United States. So sometimes people do need some T3, and there's also natural options. There's porcine thyroid, like Armor or Nature Thyroid or NP Thyroid. But there's also some bovine options out there. So there are many factors. I mean, you brought up, and I went off on this big tangent regarding hormones, but perimenopause is when women have more of a confidence to deal with their health. They're sick of being pushed around and being told everything's okay, and they know everything's not okay, and something needs to be addressed. So that's when it often comes up in perimenopause. But these issues have been going on for years, if not decades, prior to finally being frustrated and demanding help.
So one thing I do want to point out here, though, like, we're not here, Dr. Theresa and the Health Food Advisor here is not here to diagnose or to treat or to advise you of anything. We're just here to provide some advice and so forth. But if you do have any kind of existing conditions, or some of these things that Dr. Theresa is sharing is resonating with you, please check with your healthcare provider and your specialist so that you can get that addressed and see how they can help you there. One thing that kind of came up was I think of in terms of I know why women suffer more, because their hormonal balances are they're just getting more frequent changes compared to guys. But as well, kind of what I'm hearing is, I kind of think of it from a guy's, my analogy is kind of like the thyroid's like an intersection, it's a really busy intersection, and there's a traffic cop sitting in the middle, and it's regulating all these things coming into the intersection and how smooth it flows. But how that gets impacted is also depending on all those other intersections that are surrounding it. So when you're saying all these systems and all these other different, like the liver, the thyroid, the adrenals, all these other different things, if they're not functioning well, then this part of it, which is our thyroid, is going to be overly stressed. It's going to deal with a lot more traffic, right? So we have
A lot more signaling to it.
Exactly.
Yeah. So a lot more requests. It's asking for more. There's more requests going to it. Come on,
the
give
police
us some
is blowing the
more.
whistle really like
Yes.
a lot, right? Because it's warning, warning, warning. And so you need to, the thyroid could do it, but eventually it'll get overtaxed.
Yes. Yes.
So my question,
go ahead.
Sorry, my question for you is also like when you're going to get these tests done and you're going to the doctor's office and they tell you, I know somebody who was told their antibodies were high levels, but their TSH was normal. Like, so, I mean,
my God, that just,
what does that mean? Because you're thinking, okay, you want,
I mean, logically,
but things haven't changed, right? You're still feeling tired. You're feeling still anxious. You're still feeling.
Exactly. So things have changed. You have antibodies. Antibodies are not a normal aspect of good health. So having antibodies is saying there is a problem. So we need to find the solution to the problem. And just saying, oh, it doesn't fit in our current medical, flow chart that we made to diagnose you is a bunch of baloney because something is going on. That has to be, if you have high antibodies, autoimmune conditions, most people know autoimmune, it's attacking yourself. Your immune system is attacking itself. And there is there's a strong link in research, but this is just known through physiology that when a fetus is developing, the cells for the thyroid and the cells for the gut come from the same place. So if you have auto antibodies, autoimmune issue with the thyroid, 99.9% chance there's something going on in your gut. There's, many things. I mean, generally, it's called leaky gut or intestinal permeability is going on. You can look at different markers like zonulin, and you can do stool samples to see what's going on. You can do these breath tests to see if you have SIBO, which is small intestinal bacterial overgrowth. There is a big problem going on and some simple things linked with that. So we're going to address why that's going on. But gluten is also, you can look that up through bread, through grains. Gluten is highly linked to stress, the intestinal lining, causes inflammation, causes leaky gut. So again, you don't have to be quote allergic to it because people always check if they have an allergy to gluten. When it comes back, they're not allergic, man. They're just stuffing it away. And if you don't have any problems with gluten, you don't have any gut issues, you may not have to stop bread. I'm not saying everybody in the world has to stop bread. You better have a strong, very strong tight junctions in your intestinal lining. And if you have any, what would be called a trigger food once in a while, it's not going to create leaky gut. It might cause a little gas and bloating because it irritated it, but you give your body time to heal and you're fine. But there's most likely another autoimmune situation going on. They've also shown that if you have high antibodies, down the road, they're doing a waiting game. It is attacking your thyroid. It is white blood cells infiltrating your thyroid and causing damage. The rate that it's causing is going to be connected to other health factors. So maybe you're a lucky person, but the rate is so slow, it doesn't really do much before you pass away. But that's not usually the case. It's usually at a rate that's going to catch up with you, which it could be in a year, it could be 10 years. That's part of the problem. They're like, I'm not going to, the doctor's like, medically, if your TSH is in range, which means you're making enough thyroid hormone at this very point in time, there's not a problem. But your thyroid is being, attacked. How is that not a problem? So go ahead.
So sorry. So is Hashimoto's directly caused by thyroid health? Like if your high thyroid is not healthy, then Hashimoto's is one of the autoimmune diseases? Or what actually causes it? Yeah, sorry.
So hypothyroidism is when you have low thyroid hormone. Okay. What causes low thyroid hormone? Up to 97% of the cause is what's called Hashimoto's, which was the discovery that it's being attacked by antibodies. So Dr. Hashimoto is the one that discovered the reason why up to 97% of the population has low thyroid hormone is that it's being attacked. And the antibodies that are being attacked, one's called TPO, thyroid peroxidase, another one's called thyroglobulin, very important aspects inside your thyroid that is, along the way of making thyroid hormone, it's being attacked. So when something is getting attacked, one, it's going to stop that process of making what it's supposed to be making. And then also it causes inflammation. So you get extra swelling. So then you're going to get other white blood cells who come in there to deal with the swelling. It might not even be antibodies. It's like when you cut yourself and you get some redness and swelling going on because there's damage. Well, if there's damage going on the thyroid, that's where people start getting nodules. They get their goiters, they get other problems. And there can be people who have nodules and their lab work is in range. Therefore, they are, quote, okay. And it just blows my mind. So one thing that they overlook is something called the stages of Hashimoto's. Most people don't realize they have Hashimoto's until that very end stage that your doctor actually says, hey, your TSH is high, your thyroid hormone T4 is low, and you have lots of antibodies. Now you have an official diagnosis for your insurance company. But prior to that, there's a huge genetic predisposition. So think about in your family, because again, a lot of times it's not diagnosed. If you have your mom, an aunt, an older sibling, a female or male that has any symptoms correlated that possibly could have been thyroid, low energy, fatigue, maybe some psychiatric issues, depression, anxiety, they may not know the root cause, but just put that in the back of your mind that, hey, that could be partly me. And then the second stage is this immune cell infiltration. And that is often like your friend where TSH is normal, but your antibodies are going up. So, and this is a train that's not going to stop unless something is done. So that's like stage 2. And then medically they're like, well, I can't give you anything because your hormone levels are fine. And they don't think about the entire body. What is going on? What is the root cause? Why don't we put the fire out instead of letting this, flame just continue on and on? At some point it will crash. So that's generally the second stage. Then here's when you're getting symptoms. So this is often the battle between the doctor and the patient. Well, I feel tired. I feel fatigued. I don't have any energy. I don't want to get out of bed in the morning. I can't focus. I can't lose weight. I am working out more than my friends. And I am only eating 1,200 calories a day. And then, of course, that psychologically plays on you and you start getting depressed. You start having anxiety and questioning yourself. And that is actually in this stage 2. It's a battle between the doctor and the patient. And the symptoms does not correlate to them, what's on blood work, and they let you go. Well, then it still continues to a subclinical phase where now your thyroid hormone levels probably are shifting. They're going lower. Your T4 is going lower. They should be looking at other markers like free T3 and the reverse T3 we were talking about. And let's say they already are looking at your antibodies and your antibody levels are going up and your TSH is going up, but they're still in the reference range. And they are glued to that reference range. And that's why, John, when you asked earlier about blood work and baseline, you should know what is your numbers when you feel healthy. Because if you feel healthy with, TSH being one of the markers, let's say it's at 1.2 and now it's at 3.1 and some labs are up to 5. They're not worried about you until it's up to 5, but you're at 3.1. That is way over your normal of 1.1, whatever it is. And there's a lot more data and understanding by functional medicine doctors that like 0.5 to max 2 is the optimal range. That is a very narrow range.
And we're here to prevent. Like we're here to help people prevent before you get to even that. Because you're saying 1 point something to 3 point something. That's triple. And if that's still okay, you're probably hitting the like kind of your engine's kind of overheating at that point. And if you keep going, then it gets to 5 much easier. We had a question, come in that asked, where do we get iodine? Like other than people just know iodine salt, but where would someone start with?
And how much should they take, right? And how much they should take.
Oh yeah, that's going to be an interesting response regarding how much they should take, because being a researcher and a scientist, and I'm very open-minded because of course there's data out there how high doses of iodine is harmful, and then high doses of iodine are very helpful. And the bottom line is you need to know what you're doing and what you're working with. What are the levels in that person? And look at all these other factors, because sometimes you need to have a lower dose versus a high dose. So I'm going to jump to that. But the first question, which is, where do you get iodine? Well, naturally, iodine comes from the sea. It comes from the ocean. So your seafoods and your seaweeds are going to be highest in iodine. That's going to give you microgram amounts. And yes, of course, it's helpful. However, it's generally not enough for the concentration of iodine we need for our thyroid, which can hold up to 50 milligrams of iodine. And then our entire body and other glandular systems need and hold a lot of iodine. So now you're like, well, what should I do? I do not recommend taking an iodine supplement that is in a milligram amount that came from the sea. So there's like natural ones that'll be like, here's 3 milligrams of iodine that's made from seaweed. The problem is there was some older studies, and I'd have to pull them back up to tell you exactly which ones they were, of companies trying to do that, but they were also looking for heavy metal toxicities. And all of them came with such high heavy metal toxicities and contaminants, so sad, from our beautiful oceans, that in concentrating it from something natural, you also concentrated many other toxicities. So that's sad. Eating it, it's going to be okay because you're not going to eat that much and your body's going to get it out. People will think about salt, iodized salt, and that was probably one of the best public health initiatives done in the 1920s. However, there are many factors. They're putting iodine into a refined salt. So they took a whole salt, took all the trace minerals out of it, they bleached it, they add a bunch of aluminum silicate, the aluminum, which we don't want in our body, associated with a lot of mental disorders, because it's a wonderful anti-caking agent, so your salt doesn't clump together. And then they filter iodine in it. The iodine's like I want to say smoke, it's not smoke. It's a mineral, it's a metal, a fume. They put it in there and they give it to you. Well, the iodine, like a lot of it, and I don't want to say the wrong percentage. Being a scientist, I want to have the right number. A lot of it evaporates off on the shelf in the store before you even use it. And then, at least here, in the United States, I think mostly around the world, starting in the 1980s, they started going, stop eating salt. Don't add salt to your food. You better eat a low salt diet. Salt's gonna. So guess what? The one source people had in salt, people aren't even eating iodized salt. But again, because of the other contaminants, just like a concentrated seaweed, I don't recommend that iodized salt. The best way is going to get in an inorganic form, like a Lugol solution, which can come in a liquid form or a tablet form. It's free of contaminants. It has both iodine and iodide in it, and you need to supplement your diet. So yes, in many cases, we need to supplement our diet. And, on a sidebar, because I do want to give a shout out to all the other wonderful nutrients. Can't leave them out. Look at the periodic table. We need selenium. We need zinc. We need magnesium. We need a lot of vitamin D for our thyroid. People overlook that tremendously. We need that vitamin D. We need all our base nutrients, but those other minerals are very, very important along with iodine. You don't ever just increase one of them all at once. So then the amount to take per day, generally a 1 milligram dose is, up to a 3 for most people is not going to cause some type of negative reaction in the thyroid. When people have a negative reaction, because I get patients come to me, they want iodine therapy, but they've done things in the past that they got ill from or they had bad reactions to. And it's because there are other issues going on in the thyroid. If you have a lot of halogens in there, which would be bromine or fluorine, they're bromides or fluorides, they're other in the same family on the periodic table, and they're in our environment. The fluorides, we're all thinking of water and toothpaste, so there's those ways to come in the body, but bromides are in, it's a stabilizer in our bread. Potassium bromate, it's in everything that's non-flammable. Think of your carpets, your curtains, your clothing, the new car smell. It is all around us. It's in a lot of medications, and fluorides in a lot of medications as well. And if you don't have the receptor sites in your body, because every cell in your body needs iodine and it's open, another halogen will fit right there. So it'll go in when it's circulating, as a baby, and you had them in, the non-flammable pajamas, and our skin is our largest organ and wonderfully absorbs it if it can, because our skin has a high reserve of iodine if you have that iodine. So it needs something there. And then these don't leave our body unless it gets pushed out, because it's stable and found a home. It's just like when we get heavy metals that log up into, aluminum in our brain or lead on our bones. It just it found its home and it stays there until something is done to get it out. So higher dose, higher than 1 milligram to 3 milligram. I generally don't recommend people doing that on their own until they check many other systems that could be affecting their thyroid, like their adrenals, their hormones, looking at toxicity levels in their body. Mercury is very important. Some people will do high dose iodine. They get very ill because they've done it wrong. I would, seek out a doctor that understands iodine therapy to do it appropriately.
Wonderful, wonderful. Well, time's come to an end. I mean, we probably do part 2 of this. And
I know I have tons of more I could talk about, but
well, you know what? We definitely will cover.
I know, we'd love to have you back.
Yeah. So actually, she is going to come back. She's going to be a regular guest. So thanks again for, hopefully people out there have learned a little bit about what Hashimoto's is, and then also kind of, if you're thinking about, you're kind of feeling lethargic, like you're saying, or just things are a little bit off. Don't be afraid to go get checked out. I think that's the first step, right? Like we're always talking about getting a baseline, so where you're
comprehensive.
Yes,
baseline.
Yes. So that thank you for tuning in, everybody. And so next Tuesday, or actually not next Tuesday, on Tuesday the 25th, we're gonna have our talk show. It's gonna be on Chinese New Year because we're getting close to that annual celebration. And next month with Dr. Theresa, she's gonna be covering heart health, another big thing, another big organ, or thyroid is a tiny one, but a heart's more important as well.
I didn't make a little heart.
That's
Yeah.
right. Close to Valentine's Day, so it's all good. It's all related.
Oops, I hopped ahead. On February the 4th, so even before Dr. Theresa returns, on February the 4th, Friday, we have Dr. Farine. She's going to come on and talk about skin health. So you just talked about skin being the largest organ in our body. It absorbs everything. It's like a sponge.
Very important.
So she's going to be covering that and how to take care of our skin, and just some advice on that. And also, don't forget that we started on January the 3rd, right? So January 3rd.
That's right. January 3rd.
Hopefully you guys have been doing your
Thousand gratitude,
thousand thankful journaling per day. So we're doing 100 days of gratitude journaling. You write down 10 things you're thankful for every day for 100 days, and you cannot write the same thing. So at the end of 100 days, you should have 1,000
different
things
that you're
so
grateful
cool.
for.
Yeah.
So hopefully, they would love to hear how you're doing in that. And again, follow us on all our platforms, on our Facebook. We're on Facebook, we're on Instagram, and we're also on YouTube. So until next time, again, just take care, and we look forward to seeing you guys all next on the 4th with Dr. Farine. Take care.
Bye.
Bye for now.
Bye.
Thanks for tuning in.